Good afternoon, and good afternoon. Welcome back. Welcome to TNF's lectures page. So this afternoon, what I will be discussing will be for 300 level students or 300 level upward. If you are in a university, or for the year 2 upward, if you are in a college of nursing. So basically, I will be discussing on medical surgical nursing. The steps, the basic information you need to know when studying med surg. That's what we do call it med surg. So the information that you need. How do you study a med surg topic? How do you go about it? So I'm going to give us a guide and a pattern on how to study med surg. So first of all, medical surgical nursing is just like that part of nursing that talk about each disease process, the pathophysiology, the causes, the signs and symptoms, and its management. So talking about, let's take for example now respiratory system. According to its system, we have some diseases under. So studying those diseases and how to manage them is what this whole med surg is all about. So I say let's take for example respiratory system. Under respiratory system, we might have a disease called asthma. So they might, as a nurse, you're expected to know what asthma is all about, the definition, the causes, the signs and symptoms, and all. So that's really what med surg is all about. So but before then, it's important that we know the anatomy and physiology of each system. So let's assume that respiratory system of that I just spoke about now. In studying med surg, you have to study the normal sequence of that particular system, of that particular disease. So let's take for example the respiratory system. As talking about respiratory system, you know that the common organs that we have in the respiratory system is the trachea, the bronchi, or should I say the respiratory system or the respiratory tree. There's something they call the respiratory tree, whereby you have the trachea, the lungs, the bronchioles, the alveoli, and all those stuff. So as a student nurse, you are supposed to know this anatomy and physiology, the anatomy of the lungs, the anatomy of the trachea, the anatomy of the respiratory tree, and also the physiology of respiration, in the sense that the mechanism of respiration. And also for this anatomy and physiology, there is a pathway, there is a guide as to how to study it, as to how to know the correct points that you have to study about. Take for example the lungs. The lungs, for example, now, if you want to study the anatomy and physiology, you're not just going to study, okay, what the whole lungs is all about. There is a mnemonics, I think, DSSLOBSFF, like that. So I will just give us a guide. So the first is D. That D is definition. That D or description. Okay, describe the lung in one sentence. The lung is an organ of the respiratory system that is responsible for gaseous exchange, that is responsible for respiration, that is responsible for breathing in and breathing out. So that's like the description of the lung. You are not just going to end there as per, oh, that's everything I need to talk about the anatomy of surgery. No, you need to talk about the size of the lungs. You need to talk about, and the other S, I said DSS first, describe, or should I say definition. Then the other S is the size. Then the other S is the shape. What's the shape of the lung? What's the shape of the kidney? What's the shape of the of other organs? You need to know the shape, like the kidney is bean shape. So you really need to know the shape of the organs. That's why I have to go back and study DSS. Then the next is L. That's L stand for location. So I said DSSL. So description, size, shape, location. Then we have sometimes they ask you to go for weight, W. W. When you talk about the location or paraventure, let's say okay, DSSWL. So we say describe, tell us the shape, tell us the size, then W, tell us the weight, how many kg it is. I think the skin is about 2.5 something kg. So you should be able to tell us when you are talking about the anatomy of physiology. Like it's a bullet point. And they said describe the lungs, describe the anatomy and physiology of the lung. You should be able to put bullet 1 description. The lung is the clinical organ responsible for. Another bullet, the size. You write it size. It is of this size. Another bullet, shape. It is of this shape. Another bullet, weight. So DSSW, weight. It is of this kilogram, or some will say kinikon by kinikon by kinikon. So you should be able to tell us the weight. Then L is the location. Where is it located? Is it at the thorax? Is it at the abdomen? Where is it located? We need to know, and we should be able to know where exactly. If it's in the thorax, where exactly at the thorax? Is it at the left side? Is it at the right side? So you need to know, is it behind? Where? So you really need to tell us the location. Then DSSWL. Then O, we have O. LO. O is for organs in relations, organs that are associated with this organ, in particular. Like the lungs now, we have associating organs. Like you make us to you explain in such a way that anteriorly we have the ribs, posteriorly we have the thoracic column, laterally we have what, medially we have what. So the organs in relation is telling us about what are the organs bounding it, what are the organs that are surrounding this particular lungs, and where are they located? Are they located anteriorly? Are they located? So I will suggest to get this Ross and Racing textbook. It's able to tell you the organs in relations and give you the specific idea that you need. Then we have, I said LO, and we have S. S is telling us about the structure itself. The structure in the sense that okay, the lungs is composed of three structures: the outer, the cortex. I don't know if you're getting it. Like the kidney now, the kidney will make us understand that okay, the kidney, we have the cortex, we have the medulla, we have the renal artery, we have the renal vein. So you really need to tell us the structure itself. The lungs, like lungs now is when is in the structure we'll be talking about. The structure in the lungs is divided into the lungs are two. One are the right lung, the left lung. One is of 3 lobes, one is of 2 lobes. One and behind at the ending part of the lungs, or shall I say posteriorly, you have the ileum, whereby other arteries and veins and blood vessels, the nerves, they pass through. So that's where you discuss the structure, is where you talk about all these things. Then LOS, then now talk about the blood supply. B, the blood supply, the venous drainage, the arterial supply. So which artery is connected to this thing, which vein is connected, you make us to know that in the blood supply. Then we have the nerve supply too, the nerves that are responsible for the innervation of this organ. Then we have the lymphatic drainage as well, the lymph responsible, the lymph nodes. And the last but not the least is the function. We talk about the function. What's the function of the lungs? The lung is responsible for respiration, the lung is responsible for gaseous exchange, blah 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 blah. So that's more like the anatomy. Then when you talk about the physiology, when you talk about the mechanism of respiration, how does respiration come about, what are the processes involved in respiration. So that's for the basic thing you need to know first in med search. That's for every system. Respiratory system, you should know the lungs, you should know the trachea, you should know the respiratory tree. Let's talk about the cardiovascular system. You need to know the heart. You need to know the heart, the structure of the heart, the anatomy and physiology of the heart, the aorta, the descending aorta and the ascending aorta. You need to know the inner structure and the outer structure of the heart. You need to know the mechanism of circulation. So that's that. Then for kidney, talking about endocrine system, of course, you know what you need to know about the organ you need to study. Talking about urinary system, you need to know the organ you need to study. Talking about gastrointestinal system, you need to know that okay, you're talking about the stomach, you're talking about the large intestine, the small intestine, you're talking about the esophagus. So all these things, as a 300 level student, as a 300 level student, you have to have all this thing at the back of your hand. So don't wait for when lecturer will come to the class and come and tell you, okay, this is what you should do. Now that you have resumed, these are the basic things you ought to have started. You ought to have started learning. So that's for anatomy and physiology. They might not even teach you in class. That's it. But you just sit in the exam and they will bring out a med-surg question, and the first thing they will say is discuss the anatomy and physiology of the lung. I be like, how far now? You not teach us? No, don't wait till when they will teach us. They will bring it. Go and check every other nursing question. You are going to say the anatomy and physiology is very important. If reproductive system, when you are talking about reproductive system, of course you should know that you will be talking about the diagram of the anatomy and physiology of the penis, of the vagina, of the male and female reproductive system as a whole. So it's not about knowing the anatomy and physiology alone. You need to know the diagram. You need to be able to label them very well. So know the diagram, know the labeling very well as well, because that's actually the easiest way to actually get good marks in these stuffs. RN is no more theory. It's no more theory. It's now objective, so and even on the safer side. But even though as a student we're expected to know all these things because they are basic things, and I don't know if school is still doing objective now or they're still doing theory. If they're still doing theory, you really need to know this. Then let's go into med-surg on the disease process itself. So after talking about this anatomy and physiology, the next will be to now talk about the disease itself. So let's take for example asthma in respiratory system. First of all, the first thing you will do is to define asthma. What is asthma? So that's definition first. Asthma, we are going to define asthma is a respiratory disease caused by kidney resulting into kidney. So your definition should have a cause and also the resultant effects. Is a disease process caused by, resulting to. Don't know if you get it. So that's that. Like hypertension now. Hypertension is a cardiovascular disease caused by an elevated blood pressure resulting into. I don't know if you get it. So we really need to go understand that. Then next is etiology. Another name for etiology is causes. So what are the causes of hypertension? What are the causes of asthma? What are the risk factors responsible? What are the etiological factor of this particular disease? Then another thing that might be of help is knowing the epidemiology. Epidemiology, of course, the taught us in community yes, thereby they will tell us that okay, one out of this asthma is common in 1 out of 100, 2 out of 100. Okay, in Nigeria, like how many Nigerians usually have asthmatic attack in a year? So that's like epidemiology, how common it is, how common it is in Nigeria or in the world at large. Or like stroke now. Stroke is one of the leading cause of death in the world. So those are part of epidemiology. Hypertension is one of the common disease, that's just epidemiology. So you can choose to learn it as well. Then after that, to talk about the signs and symptoms of this disease. So how will you know, okay, the person is having an asthma, the person is having an hypertension, what are the causes, what are the signs, and what are the symptoms. So after studying that, now talk about the prevention. How can we prevent this asthmatic attack? How can we educate ourselves? How can we promote our health in ensuring that we prevent this asthmatic or this hypertension? So that's prevention. The other one is now management is where we really need to emphasize very well in research, because of every disease there is always a management. So this management is divided into three. We have the medical management, we have the surgical management, and we have the nursing management. The medical management is where we have to use drugs. It's even more than three. There are times we have conversational management, whereby we just treat according to the signs and symptoms, just like that. Lifestyle modification management, whereby we have the person, okay, you have to adjust your diet, adjust your life, and stop smoking, stop drinking alcohol. Lifestyle modification management. Then we have nutritional management as well, or we call it dietary management, whereby we place patients on special diet and all. But major three management that we have is the medical, the surgical, and the nursing management. Medical management, of course, the use of drugs, or we call it pharmacological management. So it's under med-surg, you have to know your drugs very well, the pharmacology of your drugs. So there is a video in this channel, in this page, on the pharmacology, on studying pharmacology. What are the necessary things you need to know when studying pharmacology, when studying drugs? Talking about the dosage, the side effect, the contraindication, all those things. So you can check it at pharmacology in the page. I don't want to talk much about it, because I've already done a long video about pharmacology. So that's for medical management, the usage of drugs and all. Then surgical management is where you have to make use of surgery to adjust, to manage the patient. You have to go check out different surgeries, like talking about kidney now, kidney disease. There might be a place where they have to do for a patient that have pyelonephritis. They may have to do some surgical incision or surgical intervention for that patient. For patients that have kidney stone, they may have to run through some things like lithotripsy, all those stuff. These are surgical interventions. You need to know them. And nursing management is a point of concern for us as a nurse, because that's where it's really much important. And lest I forget, talking about medical management, if it were to be in a question setting and they ask you, okay, discuss the medical and nursing management of this patient with asthmatic attack, please, when you're talking about medical management, the first thing you start first is investigations. Please, let's not forget the first thing, because some people will just go through the drugs straight. You give this patient, no. The first thing you start is investigations. Are the investigations that will be carried out on this patient, and why are you carrying out that investigation? Okay, peradventure, I say patient that have asthma. First of all, we are going to carry out physical examination for that patient. We are going to hear the lung sound. So you put physical examination is part of the investigation you will do. Yes, vital signs is part of the investigation you will do. Medical management, then investigation, chest x-ray. Carry out chest x-ray to check the lungs. Yes, the structure of the lungs, to check how far, So those are the things. Another test, you might have to run a complete blood count. You might have to rule out other stuff. Why are you running the complete blood count? Is that you want to check the PCV level? There must be a reason for that, and you are expected to put it in that medical management before you now go into, okay, I will administer bronchodilator such as salbutamol to dilate to relax the bronchial muscles. that's now entering the drug part. But before you enter the drug part, you must talk about the investigation you will carry out first. Please, let's not forget. So back to nursing management. Nursing management is divided into three. We have nursing process, we have nursing care plan, then we have general management. Nursing process is the use of ADOPI, which I've discussed earlier for 200 level students. We have to assess the patient, assessment, we have to diagnose. We have to take note that nursing process is different from nursing care plan. If they say you should use a nursing process to manage this patient, there is no need for you to open a table. What you just have to do is, okay, first thing first, and in the use of nursing process is assessment. So what are the things you need to do in assessment? Physical examination, of course, observation, checking of the patient vitals, ensuring other investigations are being carried out. Those are under assessment. History taking, under assessment. So you now put, after you are done assessing, and of course for everything you are doing there should be a rationale. So you're expected to be putting the rationale inside. Okay, I'm going to carry out physical examination from head to toe. The head is clinical, the chest is cleared, blah blah blah. I'm going to carry out vital signs. I'm going to check patient vital signs to obtain baseline data. Temperature is normal, pulse is clinical, respiration is a bit high, is tachyphonic. So you are going to put all those things in your assessment. Then the next one is diagnosis in the sense that via your assessment you should be able to get a clinical judgment of what is happening to that patient. Now a patient that you assess and you saw that the chest is a bit tight, the respiration is a bit high, that's to tell you that there is an impaired breathing pattern, there is an ineffective breathing pattern. So that alone is a diagnosis. Ineffective breathing pattern, that's the problem. There is an ineffective, this patient cannot breathe very well. Due to what? What's the cause? So in a diagnosis you have the problem itself. According to NANDA, you can go check up on NANDA and check each diagnosis. They will give you an effective breathing pattern. Yours is to find the relating factor and evidence by. So now it says somebody is having an effective breathing pattern. Related to what? What's the relating factor? Of course, the relating factor is the asthmatic attack that this patient is having, related to contraction of the bronchial muscle, or related to respiratory muscle fatigue, or you just have to find a cause of that. Then instead of the bronchia to be dilated, there is a contraction. Instead of relaxation, there is a contraction. There is already bronchial dilation, the opposite of that. That's the cause of what is happening to that patient. So that's your relating factor. Evidence by what? Evidence by a patient that is wheezing. Evidence by a respiratory rate that is higher than normal. Expect a respiratory rate of 32 cycles per minute. That's high. So that's diagnosis already. And if it's pain, acute pain related to what? Physical agents. Evidence by pain scale of 5. Patient verbalization, that's it. So diagnosis is not really hard to get. Then outcome identification, which is your O. So what are your plans? What are your goals? What do you intend doing that? Okay, after managing this patient, the respiratory rate will be to 20 cycle per minute or 18 cycle per minute. That's your outcome identity. You're identifying what your outcome will be like. Then planning, you start planning. What are you supposed to do? Then outcome identification and planning, they tend to go together most of the times. Then implementation, action is exactly what you do. Ventilate the patient, open the patient to air, where the patient should not be stuffy, create an enabling environment, put patient in a comfortable position, a Fowler's position that can aid breathing, that can aid breathing. So that's your interventions. Then you have your E, which is the evaluation. What was the result? Okay. After 15 minutes of nursing intervention, patient's respiratory rate came back to 20 cycles per minute. The goal was met. So that's that for nursing process. Then nursing care plan. Nursing care plan is a bit different from nursing process because nursing care plan involve you setting a table with columns and rows. I wish with an S pen I'll have tried to say I can fix that on the screen, but don't worry, we'll reach that level very soon. Talking about nursing care plan, of course we are not new to the system. What I'll just do is just to revise with us again. I'll give us this mnemonics. Noise is the mnemonics for nursing care plan. We have N, we have O, we have I, we have S, we have E. So N, okay, before we go into the table, first of all is the title, nursing care plan for Mrs. Chase with the medical diagnosis of hypertension. That's it. Or medical nursing care plan of Mrs. Taye, a 32-year-old patient with hypertension, with asthma. So that should be a title page. Then you now rule your table with rows and columns. Then the first will be your date, and time. Yes, date and time. Then after you have your serial number. Then after you have your nursing diagnosis, which is N. Then you have your O, which is your nursing objectives. Then you have your I, which is your nursing. Please note that nursing must be there. Nursing diagnosis, nursing objective, not just objective, nursing objective, nursing interventions. S for scientific rationale. That one does not carry nursing, just scientific rationale. Rationale is talking about the reason why you are carrying out those actions. Then E is for evaluation, nursing evaluation. I come again, your dates and time, your serial number, your nursing diagnosis, your nursing objectives, your I, nursing interventions or actions, your S, scientific rationale, then your E, nursing evaluation. So just the way I explained, nursing diagnosis, once you have your nursing diagnosis, like someone is having hyperthermia related to what? Inflammatory process. Evidenced by thermometer reading of 38 degrees Celsius, 39 degrees Celsius. So that's your diagnosis. Write it with joy and happiness in your diagnosis. Then I told you again, diagnosis, we have a relating factor, which is the cause, and we also have an evidence. What is the evidence? Okay, this person is really having an hyperthermia. This person is having an hyperthermia because the temperature was high. It was 38 degrees. It's high now. So your diagnosis will now be hyperthermia related to what? What's causing that person to have it? To have a respiratory rate of what? And to have a thermometer reading temperature of 38. It's an inflammation. There's an inflammation that is taking place. So you put it inflammatory process, related to inflammatory process, evidenced by thermometer reading. Everybody will know that that's temperature. Thermometer reading of 38 degrees. If it's 39, put 39 degrees. So that's perfect for your what are they calling it? For your diagnosis. Check through NANDA. You will see different diagnosis. Then you find the relating factor there. You find the evidence there too. Okay. Objectives. What is your goal? Patient temperature we range between normal. What is normal? Don't just put normal. You need to give us a measurable value. So we range between normal. We range between 37 to 37.2. It has to be reasonable. Somebody that his temperature is 38 will not just tell me that with clinical intervention, person temperature will just crash back to 36.5. No, your goal have to be, your objective have to be realistic. So somebody that is having a temperature of 38, you can say okay, the temperature will come back to 37.5. So you now say the patient temperature will will reduce by 2, by 5. I don't know if you get it. We reduce by 2 degrees Celsius, or reduce by 2 to 3 degrees Celsius within how many minutes of nursing intervention? Within 15, or 30 minutes, within 15 to 30 minutes of nursing intervention. Don't can tell us 45 or 1 hour. Patient will die, patient will have seizure, patient will have convulsion. So that's an immediate action. You have to do something. Fever, ineffective breathing pattern, anything related to fever, anything related to breathing, anything related to circulation, there are immediate intervention you have to do. You don't have to say you want to wait for 1 hour of nursing intervention but the patient will be okay. No, that's not real enough. That's not sensible enough. So I come again. Patient temperature we reduce by 2 or we reduce by 3 degrees. So that's from 38 to 30. Reduce by 2 will be okay. Somebody that is 38 point, reduce by 1 to 2 degrees Celsius. Or we fall to patient temperature, we fall to 37.5 within 15 to 30 minutes of nursing intervention. Good and fine. So what are your nursing interventions? Number 1, expose patient to air. Especially why are you exposing patient to air? Heat loss by convection. Tepid patient. Why are you tepid patient? Because the scientific rationale, I'm giving it scientific rationale of like that. So there will be an heat loss via conduction, or expose patient to fan. There will be an heat loss via convection. You need to go and know the scientific rationale. You have to have a reason. Then peradventure, pharmacological management is really the last thing. So I've said number 1, expose patient to air. Number 2, tepid sponge. Number 3, expose patient to fan. They can say fan and air is the same. So let's find another thing. Remove thick clothes from patients and wear patients with light clothing, so to prevent also. So that's that. I've given us 3 nursing intervention. Then the 4th one will be pharmacological management. That should be your last thing. So you now say administer antipyretics to reduce body temperature, to work on the thermoregulating center of the brain to reduce the patient temperature. That's the rationale. Well, so notice that I talk about non-pharmacological thing, 3 non-pharmacological thing first before I now talk about antipyretics as the last thing. In nursing intervention, we are not to start with drug. We are not doctors that we start with drugs. We are nurses. We are going to carry out our own nursing action first before we now end it with drug. So your number 4 or number 5 should be drug. Your number 4 or number 5 action will now be drug. And when you're talking about drug, you should be able to know the drug in the sense that, okay, number 5, administer antipyretics such as what? Paracetamol. How many milligram? 600 milligram intramuscular. Start. So you need to tell us the dosage and routes and the drug itself. Then evaluation. Patient temperature reduced to 37.5 after 20 minutes of nursing intervention. Perfect. So that's nursing care plan. See, it's easy. Then general management. That's when you talk about apodicera. The video is already going more than expected. Where you talk about admission, talk about positioning, you talk about observation, that's checking patient vital signs, you talk about diet, what the patient is eating, you talk about drugs, D, another D again, you talk about I, intake and output, talk about C again, care of the patient, skin care, everything, every care you have to perform there. Talk about E is talking about exercise. You talk about R is talking about rest, and we have another R talking about rehabilitation. Then we have A, advice on discharge. So that's apodicera. So that's all about med-surg. If there's any other thing, I will still let us know. So peace out. Thanks for staying tuned. God bless you. Don't forget to like, don't forget to comment, share and subscribe. Only you should not be enjoying this, and I pray that we do more. We'll also be discussing on other topics as a year 3 student, and I pray God will help us. We talk about mental health, talk about maternal and child health, the courses we should be the topic we should be expecting. Thank you so much.